Hi guys, welcome back to the channel. So last class we have started osteoma and we have finished osteoma. We have seen it is mainly associated with Gardner syndrome. So we'll be starting Gardner syndrome today. Gardner syndrome, clinical presentation and pathogenesis. It is an autosomal dominant trait caused by mutation in the adenomatous polyposis coli APC gene on chromosome 5q. So it is the autosomal dominant trait and mutation in APC gene which is present on chromosome 5q. Now Gardner syndrome, presence of osteomas of skull and mandible, multiple epidermoid cysts, supernumerary and impacted teeth, fibromatosis, congenital hypertrophy of retinal pigment epithelium and multiple adenomatous polyps of colon. Mainly, Gardner syndrome is a tetrad. First is osteomas, second is epidermoid cyst, third is fibromatosis and fourth is polyps. So these are mainly the tetrad for Gardner syndrome, these four things: osteomas, epidermoid cyst, fibromatosis and polyps. Now coming to osteomas, frequently will be large multilobulated masses at the angle of mandible. Teardrop shaped osteoma will seem to hang from the inferior border of the mandible or the condyle in Gardner syndrome. About 50% of cases will exhibit 3 or more osteomas of jaw and in frontal bone also. Okay, I have told you in last class, when it is associated with Gardner syndrome, it is not the single entity, it is present in multiple. So 3 or more osteomas in jaws, and it is also one of the skull bone which is more common is the frontal bone. Now, odontomas, supernumerary teeth and impacted teeth are also found at an incidence rate of 17%. So, along with the osteomas, odontomas, supernumerary teeth and impacted teeth are also found. Now, coming to intestinal polyps. First was osteomas, second is intestinal polyps. डेवलप लेटर दैन ऑस्टियोमास. तो पहले ऑस्टियोमा डेवलप होगा, उसके बाद इंटेस्टिनल पॉलिप्स आएंगे until patient reaches early 20s. Malignant transformation is assured and time dependent. तो इंटेस्टिनल पॉलिप्स का malignant transform होता ही होता है. 5% transformation at puberty, 50% by the age of 30 and 100% after aging 50. So these are the transformation rate, malignant transformation rate for intestinal polyps in Gardner syndrome. Okay. In addition, Gardner syndrome has an association with carcinomas of small intestine at the ampulla of Vater, medulloblastoma, thyroid carcinoma and hepatoblastoma. Intestinal polyps के अलावा it is also associated with carcinoma of small intestine, medulloblastoma, thyroid carcinomas and hepatoblastomas. Now first was osteoma, second is intestinal polyps and third is epidermoid cyst. Developed in about 60% of patient. Epidermoid cyst 60% of patient में मिलते हैं. Most frequently seen on face, scalp, arms and legs. These are the common site for epidermoid cysts. They appear before puberty and development of intestinal polyposis. Okay, so epidermoid cyst appears before puberty and the intestinal polyposis से पहले होते हैं, ये आते हैं epidermoid cyst. ऑस्टियोमास और एपिडर्मोइसिस दोनों इंटेस्टिनल पॉलिप्स से पहले आते हैं. इंटेस्टिनल पॉलिप्स इन दोनों के बाद आता है. नाउ सॉफ्ट टिश्यू फाइब्रोमास एंड फाइब्रोमेटोसिस, दिस इज द फोर्थ. तो द टेट्राड ऑफ गार्डनर सिंड्रोम इज ऑस्टियोमास. फर्स्ट इज ऑस्टियोमास, सेकेंड इज इंटेस्टिनल पॉलिप्स, थर्ड इज एपिडर्मोइसिस एंड फोर्थ इज soft tissue fibromas of fibromatosis. So we'll be dealing soft tissue fibromas and fibromatosis in next class. Okay, till then, like, share, subscribe and comment. Bye.